Good evening and welcome to Chicago Tonight. I'm Paris Schutz.
And I'm Brandis Friedman. On the show tonight.
The truth is, this did unfold more quickly than we had anticipated.
Caught by surprise, chaos in Afghanistan as the country's president flees, the Afghan army collapses, and the Taliban take control.
Understaffing, burnout, and poor working conditions. We hear from nurses on the front lines of the pandemic.
A city council committee led by an alderperson under indictment spends heavily with little to show for it.
The best place, the safest place for students to be is in school.
Chicago Public School students head back to the classroom in 2 weeks. We talk with the district's interim CEO about returning to school as COVID cases rise.
New research shows a rise in anti-Asian violence. We hear from 2 local community leaders.
More Chicago organizations are requiring COVID vaccines. That and more business news from Cranes.
And a group of students saying yes to clean energy and working to bring solar panels to the west side. But first, some of today's top stories. The head of the Chicago Park District says it's taking action after reports of sexual misconduct and abuse among lifeguards in the department. Today, Park Superintendent and CEO Michael Kelly says 2 high-level managers in the Beaches and Pools unit have been suspended, and 40 others have either been suspended or fired, and some have resigned. Kelly says he's also establishing the Office of Protection to handle future harassment complaints.
I have committed to this from day one. My commitment to that young woman, that family, and all these complaints is I'm going to root it out, and I'm not going to stop. It's frustrating. This investigation and the timeliness of this investigation is frustrating, but it's playing out, and it's starting finally to play out in our favor, and I don't want lost sight. These suspensions today are big. This is going to send a ripple effect through the district.
And this action comes after a WBEZ investigation into sexual harassment in the Park District, and the Park District's Inspector General is also investigating. Neighbors in the south suburbs will have a new area code when requesting local phone or cellular service. The Illinois Commerce Commission says the new 464 area code will overlay the current 708 area code, which serves most of western and southern Cook County and eastern and southern Will County. The 464 area code will become available when all prefixes in the 708 code have been exhausted, which is expected to be in January. And with a bulldozer and road closures in place, construction on the Obama Presidential Center is finally getting started. Progress on the $500 million center has been delayed by lawsuits, concerns about displacing black residents in the community, and a federal review since its location, Jackson Park, is on the National Register of Historic Places. The 19-acre Lakefront Center is expected to include a museum, public library branch, and a children's play area. The former president's documents will be available in digital form. The Obama Foundation says a formal groundbreaking ceremony will take place in the fall. Up next, we dig into the details on the chaos in Afghanistan. Stay with us.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
Earlier this afternoon, President Biden delivered his first remarks since the swift fall of Afghanistan to the Taliban. The rapid deterioration happened as the U.S. moved to remove all embassy and support staff from the country. The president says he stands by his controversial decision to withdraw, but acknowledged his administration was caught off guard at how quickly the country collapsed.
The truth is, this did unfold more quickly than we had anticipated. The Afghan military collapsed, sometime without trying to fight. American troops cannot and should not be fighting in a war and dying in a war that Afghan forces are not willing to fight for themselves.
And joining us with more are John Mearsheimer, professor of political science at the University of Chicago and a foreign policy specialist, Cecile Shea, a non-resident senior fellow on security and diplomacy at the Chicago Council on Global Affairs, Alberto Cole, professor of law and U.S. foreign relations at DePaul University, and Khalil Marar, associate professor at Governors State University with a specialty in foreign policy and terrorism. Welcome all of you back to Chicago Tonight. Cecile Shea, I'll start with you. Why, after 20 plus years of combat, do you believe the country fell so quickly to the Taliban upon American withdrawal?
Well, I happen to be one of the people who think that it was inevitable. And indeed, when I served in a senior position in the U.S. Embassy in Islamabad, the Pakistanis would tell us daily that one way or the other, eventually the U.S. was going to pull out of Afghanistan and they were going to be dealing with a Taliban-led government there. And that was one reason why the Pakistanis were constantly hedging their bets for these whole 20 years. So I don't think anyone is surprised that it happened. It happened very quickly. It happened in weeks. I mean, one of the questions people are asking is if we had pulled out in the winter rather than the summer, would that have slowed it down? But really, once it became clear that the warlords were changing sides, and really once it became clear that the government was getting on airplanes and flying away, it was inevitable it was going to happen quickly. People just saw the writing on the wall, frankly.
John, and as we look at these chaotic scenes from the Kabul airport, John Mearsheimer, was there anything the Biden administration or the previous Trump administration could have done to ease this withdrawal, or do you agree with Cecile Shea that these scenes were inevitable?
Well, I don't think these particular scenes were inevitable. If the Trump administration had been in power and they had anticipated how quickly the Taliban would win, or if the Biden administration had been able to anticipate how quick Taliban would win, this obviously wouldn't have happened. But there were very few people who thought that the Taliban would win so quickly. And you want to remember that the Biden administration had an incentive not bail out quickly, not to prepare for the exits quickly, because that would guarantee that the Afghani military would collapse. So they waited to the last moment, and that came back because in the end, the Afghani military just collapsed very quickly, and we have this messy situation.
And Khalil Marar, why do you believe there was such little resistance from the Afghani military, 300,000 strong, that the U.S. had invested billions in to stop the Taliban, as the president kind of pointed his finger in that direction, and at Afghan political leaders for failing to stop the Taliban? Why do you believe that is?
You know, I agree with both Cecile and John at the outset. And to answer your very excellent question, Paris, I would say that the Taliban has conviction, and this alliance, this loose coalition, of which 90% of that military is actually illiterate. They cannot read, cannot write, basically folds because not only do they lack conviction, but they have no faith, they have no confidence in the corrupt regime that existed in Kabul until today. And with this idea that the country fell, I would completely disagree. I don't think that Afghanistan has ever been governed by any one party. The Taliban happens to control more monopoly on violence. Monopoly on violence is something that is sort of a realm, if you will. It's quantifiable. There's a quality of it. Nobody has ever controlled the country. And the Kabul regime folded so quickly because the people that it governed lack conviction, lack faith in it. They have less faith, even less faith in the Taliban to have good governance, but they have more faith in the Taliban's ability to exercise violence, to kill them, to hurt them. And
what you're saying here is this wasn't exactly a politically stable situation before this withdrawal happened. Let's hear what President Biden said about a month ago on his thoughts of the Taliban coming in and overtaking the country.
The jury is still out, but the likelihood there's going to be the Taliban overrunning everything and owning the whole country is highly unlikely.
Clearly not the case. Alberto Cole, should there have been strong U.S. intelligence that indicated that Afghan security forces would not hold for very long and that this was a likely outcome?
This is a terrible disaster for American foreign policy, and I think we should judge the administration by their own metrics. Metric number one, they said they're going to work closely with allies. The decision to pull out of Afghanistan and to do it so quickly and to implement and follow up on the ill-advised Trump plan was done without consulting in great depth with our NATO allies. So there goes metric number one. Metric number two, they pride themselves on competence. You cannot see anything more incompetently managed than this withdrawal. Metric number three, supposedly we are going to be leading. What kind of leadership is this when we make this decision in such a rash way based on this weird obsession of wrapping up the withdrawal by September 11th. Metric number 4, the administration is supposed to care about human rights and particularly about women's rights. And we are about to hand over, we're already handing over millions of Afghan girls and women to the most misogynistic, horrible regime one could imagine in the world, even worse than those of Iran and Saudi Arabia. By the administration's own metrics, this is a horrible failure, and it will impact our credibility, both with our allies and our adversaries.
The regime you're referring to, of course, the Taliban, which was in power from 96 to 2001 until after 9/11, then the U.S. First invaded. Cecile Shea, remind us who they are and what kind of leadership that country can expect under Taliban rule again.
Sure, and I just want to add one thing to what Alberto just said. I mean, really, this president had the same choice in the end as his two predecessors, which is either stay or go. You know, there was no halfway. And now we know why, despite the fact that President Obama promised to get out and didn't get out, and President Trump promised to get out, started to get out, but didn't complete the job. It's because it was always going to be very difficult and always lead to a lot of suffering, which leads us to your question, Paris. Taliban literally means students. You know, in Yiddish, these would be yeshiva bookers. So, but a group of a group of deeply religious people that has always attracted a lot of psychopaths. And that is not in any way to say that all Taliban are sociopaths or psychopaths. A lot of them are just there for the job. The Taliban pays a lot better than the competitors, both in Afghanistan and in Pakistan. Some of them are there because they have leadership. And if you want to be a leader in a lot of parts of this country, then you're going to join the Taliban. But they are religiously fanatic. Even Iran says that they go too far. So that's really telling you something. They are Sunnis. They are primarily Pashtun, which means that they hold a lot of cultural views toward women that are not even Islamic. So a lot of their views and hardcore beliefs about women come from their Pashtun background, not really from Islam itself.
Justification for invasion 20 years ago was that they harbored al-Qaeda terrorists. John Mearsheimer, there are some in the political or military class that believe that the U.S. presence there, albeit small, did stabilize the country. Do you believe there might have been anything to gain by maintaining some kind of small presence in Afghanistan?
Well, the problem is, Paris, that one was doomed from the start, and for basically the same reasons that Khalil was pointing out before. The United States invaded Afghanistan, toppled the Taliban, and then it made the crucial mistake of staying there and trying to turn the place into a liberal democracy. And when we did that, we were doomed because we became an occupier and we got engaged in the business of social engineering in a foreign country. And the fact is that the Taliban had widespread support in the population, and the government, the Afghani government, was joined at the hip with the United States, and as a result, it did not have a lot of legitimacy. And at the same time, we were funneling huge amounts of money to that government and to the military, which led to corruption, which led to less faith among the people in the Afghani government. And in the end, this ended up just like Vietnam. I'm old enough to remember, this is Vietnam all over again.
And a lot of folks have made that comparison. Khalil Maher, there are many folks in Afghanistan trying to evacuate not just American diplomatic personnel, but Afghans who assisted Americans, translators. How difficult will it be to get them out of there and to get them some kind of asylum in the U.S.?
It's logistically nearly impossible at this point. I mean, Western governments are trying to get our own personnel out, number one. Number two, the Afghan people, you heard about the incident with the C-130, heartbreaking, devastating, of people trying to flee the country. It won't be hard once we get them here. Getting them out of there is exactly the problem. And how do you choose? We have a border with Mexico, for example, where, the previous president was talking about building a wall. The current president has no idea what to do about it. I mean, the truth is we have to look at what the not just optics are, but what John points to, what rebuilding a country means. The country remains largely unbuilt. The Taliban is taking over. Now, with that said, this is not our daddy's Taliban. I mean, 20 years ago, the Taliban is fundamentally different than the Taliban of today. We can talk about that later. But to answer your question bluntly, Paris, we can basically give them all asylum. The political feasibility and the logistics would be a nightmare.
And Alberto Cole, tell us what the future has in store with a Taliban-led Afghanistan, not just for Afghanistan, but for the United States, for Western alliances, because the fear is that they could, again, harbor terrorist elements that would be a threat to the United States.
Yes, so I mean, precisely because the Taliban are a collection of warlords, you will see eventually happen what happened over 20 years ago, which is some of the warlords in the more remote areas of Afghanistan, and Afghanistan is a huge country, very rugged, very mountainous. Some of them will find it in their interest because of money or ideological reasons or a mix of different factors to harbor and give refuge not only to Al-Qaeda-like elements, but also to ISIS, different versions of which are reconstituting themselves, by the way, all over the Middle East and in Africa. And we're going to wind up with the same problem that we had 25 years ago, and we're still going to be spending a lot of money trying to deal with that threat. At a second level of order, we also have to realize that many of our allies, especially in the Pacific, are asking themselves, how reliable is the United States? How much can we trust them? And last but not least, how willing is the United States to stand up by their friends and to follow a coherent strategy? By the way, international politics is not always about clear-cut endings. It's not about total victory or about defeat. Sometimes the best you can achieve is a long-term stalemate. We had that in Afghanistan, and President Biden's advisors actually gave him a blueprint for maintaining kind of a long-term stalemate at a very minimal cost in U.S. resources.
And clearly the president decided not to go that route. There's a lot of questions that we'll all be asking on this in days and weeks to come. But for now, our thanks to John Mearsheimer, Cecile Shea, Alberto Cole, and Khalil Marar. Thank you so much.
My pleasure. Thank you.
And now, Brandis, we toss it back to you.
Paris, thank you. A city council committee headed up by a high-profile alderperson currently under federal indictment spent nearly $200,000 last year with almost nothing to show for it. Joining us with more is WTTW News reporter Heather Sharon. So, Heather, who are we talking about, and what is this committee supposed to do?
Well, we are talking about Alderperson Carrie Austin, who is the chair of the City Council's Committee on Contracting Oversight and Equity. And you said it, they spent almost $200,000 and met 3 times in 2020, but passed no substantive legislation in the entire year.
And what has this committee actually done over the last couple of years?
Well, it's a new committee formed in May 2019, and it's supposed to ensure that Chicago's lucrative contracts go to as many companies owned by women, as well as Black and Latino and Asian Chicagoans. But that is still very much a work in progress.
Okay, so did Alderman Austin or the mayor have any response to your reporting?
They did not. And I also asked the mayor whether it was appropriate for Alderman Austin, who, as you said, is under indictment. She faces 4 counts of bribery and lying to the FBI. She has pled not guilty. But I think it's an open question whether she should remain as a city council chairman. Alderman Ed Burke had to step down as finance committee chairman when he was indicted. And Mayor Lori Lightfoot's office wouldn't tell me whether the mayor has asked Alderman Austin to step down. This is also complicated efforts by the mayor to reauthorize the city's program to ensure that businesses owned by Black and Latino and Asian Chicagoans get their share of the city's contract through a set-aside program. That program expires at the end of September, and it has to be reauthorized by the city council. But legislation to do that has been stalled in Alderman Austin's committee since the end of June, and the clock is ticking.
Okay, and before we let you go, Heather, quickly remind us how this committee was created in the first place.
Well, in 2019, Mayor Lightfoot took office after Alderman Austin endorsed her rival, Cook County Board President Toni Preckwinkle. And so for that, Alderman Austin found herself out in the cold and no longer chairperson of the powerful Budget Committee. And this was an olive branch offered to the mayor by Alderman Austin, who is very powerful alderman. She is the second longest serving alderman on the city council, behind only Ed Burke.
Of course. Heather Sharon, thanks so much for joining us.
Thanks, Brandis.
And you can read Heather's full story on our website. It's all at WTTW.com/news. Across the country, hospital systems are facing a shortage of nurses. Here in Cook County, nurses at Stroger Hospital went on strike this summer over staffing shortages. Nurses say the lack of adequate staffing has led to burnout and sometimes even caused patients to be redirected from one hospital to another. Joining us to talk about the conditions that nurses are facing are Elizabeth Aquino, president of the American Nurses Association Illinois, and Elizabeth Lawlish, a registered nurse at Stroger Hospital of Cook County and a steward at National Nurses United. We did reach out to Stroger Hospital of Cook County for comment and did not receive a response. Thanks to both of you, Elizabeths, for joining us. Elizabeth Lawlish, let's start with you, please. What hospital conditions would you say are contributing to this shortage?
I think that the hospital conditions contributing to the shortage, and I just want to say that I don't think that there's a real serious nursing shortage that before COVID. I mean, there's really only a shortage of nurses who are willing to work in unsafe environments. So the conditions over the last 18 months since the beginning of the pandemic have really been nurses not being provided with optimal PPE like N95s, gowns, all sorts of safety equipment so that we can actually work with patients. And, you know, nurses have been very fearful for their lives. Some have gotten sick at Stroger Hospital and across the system where I work. And people are fearful for their families as well. And in addition, what we're seeing is that people are leaving the hospital system. They're retiring or they're looking for other jobs, or even traveling nurses that are inside of our hospital working to supplement our staffing, you know, are planning on just working for this year and then taking time off.
And well, I want to get Elizabeth Aquino in here because you guys have a slightly different viewpoint on this. Elizabeth Aquino, you believe that you did see a shortage, currently a shortage and a shortage pre-pandemic. What was the cause before the pandemic?
Yeah, before the pandemic, we were experiencing a shortage as a result of the growing aging population, the aging nursing workforce, and the estimates expected 1 million nurses to retire by 2030. We have a nursing faculty shortage and then the nursing burnout, which Elizabeth did speak about. So yeah, the COVID pandemic has definitely exacerbated the shortage, with some nurses choosing to leave earlier. I mean, I teach at DePaul, and we have students who graduate and are a year out, and already, you know, it's been a tough year for them, and considering, you know, what other options they may have, because the exhaustion, the burnout is something real that nurses are facing. So,
and Elizabeth Aquino, how would you quantify the shortage? How bad is it?
Well, we don't have exact numbers now, but we do know that when nurses are feeling overwhelmed or there's burnout, that causes turnover. So I'm sure the numbers will come out very soon to see the direct impact, but we know anecdotally that it is happening. Nurses are not returning.
Elizabeth Lawlish, we know that a couple of months ago there was a strike with your union over staffing shortages at Stroger Hospital. How did that shortage affect day-to-day work at the hospital?
I mean, what it meant was that people were exhausted, that people, obviously, as I was saying, the conditions inside the hospital are the main factor that have contributed to, and the failure for our hospitals to actually plan for the surges around COVID. So with our strike, what we actually did was, and we hadn't struck since 1976, so close to 40 years, if not more. And not really something that in a safety net hospital is the typical thing that we do, but we actually won through our strike of one day on June 24th a commitment in writing to hire 300 additional nurses into the system within the next 18 months from hospital management, and we've already begun that process. We had 150 people at a job fair for my division, which is called medical surgical nursing, and we're planning, and people are being hired and brought into the system. So that was part of it. Plus, with our strike, we actually won exceptionally good benefits. And so it's a very attractive package. I know a lot of hospitals are having sign-on bonuses and things like that.
Something more, it sounds like,
in.
to get more nurses in.
Right.
But about about the patients, though, Elizabeth Aquino, what impact does the shortage have on patients who are coming to hospitals for treatment and care?
It has a direct impact on patients, both patients who are coming to the hospital and needing services, and due to a shortage of available beds or a shortage of staffing, hospitals may have to go on bypass, and that means that patients are not able to be cared for at an institution. We know that staffing affects the quality of care provided to patients and patient outcomes, so it significantly impacts both nurses and patients.
Elizabeth Lawless, describe, please, the challenges, because you have this experience with working in some of the COVID hospital wards.
The challenges are, as I said, not being able to have safety measures that nurses need, as well as other hospital staff. There's been a lot of discussion about that. The challenges of having too many patients, and that's something that actually hospital systems can take care of by, like I said, having hiring fairs and really promoting, bringing in nurses and retaining nurses. So those are the challenges that we face. And the idea of burnout, I think, is one that I like to flip that on its head, because it makes it seem as if it's an individual choice on the nurse or some deficiency. Whereas, what we say in our union is that it's moral distress, and that hospital systems have the money. My hospital system received $1 billion in federal COVID relief money that can be used to actually bring in more staff and retain those staff.
And Elizabeth, sorry, we've got about 45 seconds left. Elizabeth Aquino, your association worked on the Nursing Staffing Improvement Act of 2021. It has been sent to the governor for his signature. In about 30 seconds, what would that act do?
It's a holistic approach to staffing that really uses a nursing-driven, flexible staffing approach. So it helps support nurses in 3 significant ways. It strengthens the nursing voice, the direct care registered nurse related to staffing decisions, strengthens the role of the nursing care committee who address specific staffing issues within their institution. And then it also holds hospitals accountable for the provisions under the law.
Okay, we'll have to leave it there. Best of luck to you both, and thanks for the work you do, Elizabeth Lawless and Elizabeth Aquino.
Thank you.
Up next, a group of students working to bring solar panels to the West Side. Stay with us. Good evening and welcome to Chicago Tonight, Black Voices. What do you believe prevents a strong coalition of Black and Latino communities forming across the communities?
I want us to, as a nation, to find a way to come together.
Go down the block, get it from someone local, and keep the money in the community.
Black joy and the Black experience is magical.
And there's much more ahead on the program, including new data on anti-Asian incidents across the country. But first, a group of students on the West Side are determined to make a big change in the neighborhood by confronting environmental issues and working to bring solar energy to their community. Chicago Tonight's Joanna Hernandez met with some students to learn more about their vision for Garfield Park.
I feel like it's important that you should know what's going throughout your community and how you can solve bad things like the bad energy.
If we had a whole acre of solar panels, we could actually power the whole neighborhood.
Senior Kiera Turner is one of Jasmine Jones' students at El Rabi High School in Garfield Park. These young adults have put what they've learned in their environmental justice class into action.
Knowing about low birth rate and having asthma comes from the community that you in and like where you come from and stuff like that. So I didn't know that, but I learned it when I took the class.
A class that has opened their eyes to issues that impact their daily lives.
I learned that approximately 98% of children come out with asthma due to pollution while their mothers are pregnant.
It all started when Jones realized she wanted to challenge her students and change the way they viewed science by involving their environment.
I wanted to not only make it a real-world application, but how is it justice-centered? How is it actually using science as a tool to intervene in this socio-political sphere and really impact students' lives? I mean, imagine how much work we could get done if we had
Jones launched a solar panel project where students have an opportunity to think like developers. They quickly realized the benefits of having solar panels installed in their community.
It's a great idea overall, just in general, because of the pollution and the climate change that's going on. So having it here in Garfield Park is a good thing because it's a lot of stuff that go on around here that people really don't know about.
They have their eyes set on the Garfield Park Conservatory right across the street from the high school. The solar panels will provide clean energy without producing air pollution.
Over the course of 15 years, the conservatory will be saving over $500,000 just from the energy savings.
Joining the Illinois Solar for All program, these students have been able to speak with the contractors, engineers, and eventually be part of the design process.
That is a program that really focuses on helping to get solar panels in neighborhoods like ours, what we call environmental justice communities. So these are communities where the environmental score, when you research it, it is very unhealthy.
The students are hoping to submit their final proposal by the end of the school year as they work on finding funding for a big project they say will benefit the community for years to come.
We're going to be seeing changes, like stuff is going to be turned around for our community. It won't be, we're just standing by. We're actually taking precautions to make our community a better place for us.
Along the way, the project is empowering these students to find their voices.
I started feeling real good, because I felt like I was helping the community and being a leader.
It kind of made me feel like a boss because it's like I'm doing something that does some good to me and other people.
The students have been in contact with the Garfield Park Conservatory about their vision, and as of right now, a spokesperson for the Park District says they're open to the idea and are waiting to review a final proposal from the students to make an assessment of the benefits before providing final approval.
It's very important because we live here, and for so long, other industries and people, honestly, communities who don't live here, have been dictating the conditions under which we live. I think that in the future, I would say to the community to look forward to learning more from the students because they are going to be the ones teaching, hopefully communicating and sharing.
For Chicago Tonight, I'm Joanna Hernandez.
Now, the students have also worked to get the support from different organizations in the area to get the project finalized. And still to come on Chicago Tonight, a local hotel corporation bets big on the return of leisure travel amid the pandemic. That and more from Cranes. The first day of public school for Chicago Public School students is 2 weeks away. We talk with the district's interim CEO about vaccine requirements for teachers and staff and much more. And anti-Asian incidents are rising across the country. We hear from 2 community leaders about how some Asian American communities in Chicago are responding. But first, some more of today's top stories. Body camera footage of the incident that led to the killing of Chicago police officer Ella French will not be released to the public for now. That's the announcement today from the Civilian Office of Police Accountability, and they cite a court order that prohibits releasing materials during an ongoing criminal matter. COPA says the materials will be released upon the lifting of the judge's order. French was shot and killed on August 7th as she and 2 other Chicago police officers conducted a traffic stop on an SUV carrying brothers Eric and Amonte Morgan in the West Englewood neighborhood. After 5 years of reviews, lawsuits, and community meetings, ground has officially broken on the Obama Presidential Center in Jackson Park. Roads were closed off as bulldozers set up near the Southside Park that will soon be home to the new $500 million center. The Obama Foundation had to wait until the end of a federal review since the Olmsted Design Park is on the National Register of Historic Places. Not to mention, they had to wait out lawsuits and meetings with residents concerned about displacement. A more formal groundbreaking is set to take place in the fall. Local relief efforts are underway to aid victims of this weekend's 7.2 level earthquake in Haiti. The Haitian American Museum of Chicago is organizing a GoFundMe to aid a group of families in the Haitian town of Pico. USAID and other organizations are also raising funds to send relief to Haiti. More than 1,300 people have been reported dead so far after the earthquake that struck around 80 miles outside the island nation's capital, Port-au-Prince. This follows the ongoing political crisis in that country in the wake of the assassination of former President Jovenel Moïse. The head of the Chicago Park District says it's taking action after reports of sexual misconduct and abuse among lifeguards in the department. Today, Park Superintendent and CEO Michael Kelly says 2 high-level managers in the Beaches and Pools unit have been suspended and 40 others have either been suspended or fired, and some have resigned. The action comes after a WBEZ investigation into sexual harassment in the Park District.
I understand the frustration with the time it has taken to look into these complaints. Investigations never happen fast enough. But I assure every person who has been impacted by this case that this is top of mind for me, and it has been since the first day I learned about it. My office continues to cooperate fully with the Office of Inspector General and put measures in place to train, support, and protect our workforce.
Kelly says he's also establishing the Office of Protection to handle future harassment complaints. And now to Brandis for some of today's top business headlines. Brandis.
Paris, thank you. A new wave of Chicago organizations say they'll require COVID vaccinations. Hyatt Hotels makes a multi-billion-dollar bet on the return of leisure travel, and the University of Chicago gets its largest ever donation to boost financial aid. Here to go behind the headlines is Crane Chicago business reporter Danny Ecker. Danny, welcome back. So, a number of local organizations, from hospitals to a high-end gym, all recently say that they will require the COVID vaccine. Who are they, and is this going to become the new normal?
Well, it's certainly a very impactful decision that every business or school is faced with right now. Do you come out and say that getting vaccinated is a condition of employment or just a condition to use a facility? Today we had East Bank Club downtown, which is one of the city's largest gyms. It's got 8,000 members, and they said starting October 1st, if you're not vaccinated, you can't be there. We also saw today North Shore University Health System and Cook County Health and Sinai Chicago require vaccination by different October deadlines to be employed there. So, of course, most of this is just in response to the Delta variant pushing COVID cases up, and organizations realizing they have a lot of power if they can help boost vaccination rates if they take a hardline stance on this. So we could see more like this.
And we know that Hyatt Hotels has agreed to buy Apple Leisure Group for more than $2 billion. Besides the money, why is that a big deal?
So Apple Leisure Group, it's known for high-end resorts, mostly in Mexico and the Caribbean. And so with this acquisition, Hyatt is actually going to become the largest owner of all-inclusive luxury resorts in the world. And what's significant about that is Hyatt's brand is really known as a full-service hotels that relies heavily on meetings and corporate travelers, and it's in urban areas. So this is effectively the company saying, we need to raise our bet on vacationers, on leisure travel, which has actually done better than I had expected so far. So they're kind of pivoting to make sure they're not as reliant on business travel, which is still a pretty blurry outlook here.
Yeah, of course. And lastly, U Chicago has received its largest ever donation from the school's Board of Trustees. How much is it, and what's it for?
Yeah, it's $105 million. It's going to the Odyssey Scholarship Program, which funds need-based, loan-free financial aid for undergraduate students at U of C. The board is making this donation in honor of Robert Zimmer, who's the outgoing president of U of C. He's been there for 15 years. He's going to become chancellor. And about 20% of U of C students, first-year incoming students, get some financial support from the Odyssey program. And the school also gives free tuition for certain families that have less than $125,000 of income. But of course, let's remember that this is one of the most expensive schools in the country. The incoming full cost of attendance is about $83,000 this year.
Okay, no small amount there. Denny Ecker at Cranes, thanks for joining us.
Thanks.
Up next, Chicago Public Schools interim CEO talks about returning to classrooms amid a rise in COVID cases. That's a conversation that first aired on Chicago Tonight, Latino Voices, with host Alex Hernandez of Univision. Stay with us.
Don't ever miss Chicago Tonight. Subscribe to our podcast. Get a daily download of our show delivered to your desktop or mobile device. Go to WTTW.com/Chicago Tonight Podcast and subscribe.
Chicago Public Schools will require all teachers and staff to get a COVID-19 vaccine this fall. That's according to an announcement made by the district last week. This comes as CPS continues to bargain with the Chicago Teachers Union over coronavirus safety plans. And as COVID-19 cases rise, largely driven by the more contagious Delta variant, students are set to head back to school, as you know, at the end of this month. Joining us to discuss the district's plans for the upcoming school year are Jose Torres, interim CEO of Chicago Public Schools, and Dr. Geraldine Luna, medical director of the Chicago Department of Public Health. Thank you both for being here. Mr. Torres, I want to start with you. This is your first time on Chicago Tonight since taking the position. You entered the district at a tumultuous time, to say the least. Before we get into the back-to-school plans, how have the first several weeks been, and what are your priorities as students get ready to return to the classroom?
Thank you for having me. And yes, it's been a great opportunity to be back in the district. I used to be in the district in 2007, 2006 through 2008. And my priorities have been and are to re-engage almost 100,000 students who have been disengaged in some way, and then opening schools on Monday, August 30, a week before Labor Day.
Moving now to the in-person learning, Dr. Luna, more than 70% of adults in Chicago over the age of 18 have received at least one dose. And 50% of people 12 to 17 have received also at least one dose. But a significant portion of the students who will be back in school aren't eligible yet. Dr. Luna, what does this mean for in-person learning for younger students? Does requiring teachers and staff to get vaccinated mitigate risk?
Of course, if having a vaccination is the most powerful tool, and we know that nothing can substitute that. However, in addition to that, the way it's going to look like, and I know Dr. Torres can tell us a little bit more about that, but we're highly recommending the safety measures that they are already taking place in CPS, which is to continue using masks. Universal masking is so important more than ever. We know that vaccinated individuals can spread the Delta variant, COVID-19 as well. So universal masking to protect those that are not eligible still to get the vaccine, distancing, social distancing within, the permissible environment of school, and also screening, COVID testing, screening, and making sure that nobody with symptoms go into the school environment or the school as it is. And another thing is that our testing, COVID-19 testing, will be amply available to everyone to get tested.
Well, speaking of the tests and the vaccines, the Chicago Teachers Union and CPS remain, as you know, in negotiations about the reopening. Actually, CTU President Jesse Sharkey said the vaccine mandate doesn't go far enough. Here's a clip. Let's listen.
It doesn't go far enough because a lot of other people in school buildings, students especially. I mean, we're talking about there's a vaccine that's available for students that are age 12 and older. Among Black students in Chicago, for example, only 12% of those students are vaccinated.
Mr. Torres, is a vaccine mandate for students in the district's future? And will CPAs, what will they do to help increase vaccination among students?
No, that's a great question. You know, we have all the mitigation efforts that Dr. Luna mentioned, in addition to universal masking, hand washing, testing, 3 feet distance whenever possible, additional ventilation efforts. All those things were in place before the vaccine was possible, and we were able to have in-person schooling. So now that we have more people vaccinated, it only adds to it. Regarding when the students would be required to take the vaccine, that is something that we will need to leave to the CDC and the experts in epidemiology. When they say that it is more appropriate to do that, we will be definitely considering it.
So will you be checking what students are vaccinated or not? Students over 12, obviously.
So it is very difficult to get all of those data. We will be requiring, for example, our students who are in extracurricular and sports, because we often have extra requirements for those students. So we'll be requiring them to let us know what their vaccination status is, and encouraging them to get vaccinated. For the others, we're not ready to move in that direction just yet.
Dr. Luna, concerns are rising, as you know, obviously about the Delta variant, and there have been some reports that cases among children are increasing. What threat does the Delta variant pose to children? How concerned should parents be?
Yes, parents, unfortunately, unvaccinated individuals, and we can see it in our communities, which are leading the outbreaks in our cities. So we know that vaccination is the highest protection. Even in the cases that we already seen that it can personally spread, even vaccinated can spread the disease, but unvaccinated, 97% of our hospitalizations and death are associated to unvaccinated individuals. So it has become a pandemic of the unvaccinated. The threat is really for ineligible students yet. There's promises, there's nothing official yet that we can share in terms of when it will become available, the vaccine, in children 12 years and younger. But we do highly, highly encourage, and this is an effort, an incredible effort that we're doing with CPS alongside and other community members and stakeholders to try to promote, incentivize vaccination. We even have the at-home vaccination, which we go there to your home, no question asked, nothing, no ID, no documents, anything that poses a threat to undocumented or other vulnerable population, just to make sure they're vaccinated. There is an abundance of vaccines.
As we know, metrics are obviously very important, have become hugely important during the pandemic. Mr. Torres, would CPS set metrics if, let's say, just in case COVID cases or positivity rates rise? Would you consider closing schools, and what would those metrics look like?
Well, we'll be working very closely with CDPH. The reality is that we had some metrics in the spring that are no longer valid because now we have more vaccine is widely available and people are vaccinated. So the metrics will change a little bit. I don't have them presently, but we will have sort of guidelines, and the state has given us guidelines, and it's really at the discretion of the CEO when you quarantine a classroom, multiple classrooms, a school, and obviously the district. My hope, though, is that given the mitigation factors of universal masking, hand washing, 3 feet social distance where possible, and all the other things that we have put in place, that we'll be able to not only start the school year on Monday, August 30, but continue to have a vibrant, we haven't talked about this, but the mental health issues of health for students who have been instructed online and isolation have had major effects. And so the best place, the safest place for students to be is in school. And everybody agrees on that.
Okay, well, I want to thank both of you. Thank you, Mr. Jose Torres and Dr. Geraldine Luna, for joining us this evening.
Thank you, Mr. Hernandez. Bye.
Back with more Chicago Tonight right after this.
More than 9,000 anti-Asian incidents in the U.S. have been reported since the pandemic began. This is according to Stop AAPI Hate Coalition's recent national report, which states that more than 4,500 hate incidents occurred in 2020 and another 4,500 so far already in 2021. And joining us to discuss anti-Asian violence and how some community members are experiencing it locally are Grace Pai, Executive Director for Asian Americans Advancing Justice in Chicago, and Vivian Zhang, Outreach Coordinator for Coalition for a Better Chinese American Community. Welcome both of you to Chicago Tonight. Grace, I'll start with you. What have you noticed in the Chicago area in terms of anti-Asian incidents? Is it mirroring what's happened across the country?
We've definitely seen a similar trend in Chicago to what's been happening in other states and all across the country. We have seen an uptick in anti-Asian violence and incidents. And, the troubling thing is that I think even with the increase in reports that are being submitted to all these various tracking sites like Stop API Hate and others, I think it still is very much underreported, that there still are many hesitations in our community about sharing their experiences and barriers, whether it's stigma, not wanting to say that they have been a victim of, whether it's a crime or not, any sort of, racially biased incident. Or just, not wanting to interact with law enforcement or government agencies because of language barriers or other barriers.
And Vivian Zhang, what do these incidents tend to look like? Do they tend to be more physical altercations, verbal altercations, a combination of both?
As of last month, we really have not seen any violent physical altercations, but I think there is definitely an increase in verbal hostility.
And to that end, we spoke with the University of Illinois student about a recent experience that she had shopping at a Target. Let's take a look.
I was just at the register trying to return an item when this lady came up to me and tried to tell me to go back home and that, I can't control the things coming out of my mouth and that referring to the virus itself and constantly telling me that, I should go home and that some people just should go home and they don't belong here. It wasn't just fear for, this lady is verbally assaulting me, but it's the fact that I don't know if she has a knife or a gun and if she will use physical violence towards me if I didn't leave that situation.
So Grace Pye, you talked just a bit ago about the barriers to reporting incidents. How about the difficulty of reporting an incident like this?
I think it is just a traumatic experience for a lot of people to be accosted by a stranger in a public place, right? And to not know what to do in that moment. A lot of people like myself, I would freeze in that situation and not know what to do. And so then talking about it with people, right? You may want to talk about it with your friends and family, with loved ones, but there can be a lot of barriers to wanting to, file a report of something happening. I think it's not always something that people want to do.
Vivian, what have been the ripple effects in the Asian American community at large?
Well, for Chinatown specifically, I think that people have started paying attention more to local groups that represent their interests. So in this case, we recently had a rally, a safety rally, with a bunch of other organizations and Chinatown Security Foundation. And there's been more neighborhood watches as well. A lot of people have, kind of gravitated towards gun ownership as a means to feel more protected as well.
So increased gun ownership, and you're seeing that across many groups across the country. Grace Pye, what else can be done to sort of take down the temperature, to minimize these incidents, to do a better job to protect Asian Americans from this?
Well, we firmly believe that responding to anti-Asian incidents after they happen is not enough. We need to take proactive solutions to make sure that we're reducing bias and discrimination within our communities. And to us, that looks like education as a long-term approach. So we were, proud to lead the effort to pass the Teaching Equitable Asian American Community History Act, or the TEACH Act, which requires Asian American history to be taught in all Illinois public schools starting in 2022. An approach like that is a great way to educate our young people, to encourage them to build empathy, to understand other communities, and to not discriminate against people who are different from them.
The TEACH Act you mentioned just signed into law recently by Governor Pritzker. Vivian, how helpful will it be that Illinois school children will learn about Asian American history and things like the Chinese Exclusion Act? How beneficial will that be, do you think?
I think it's a very important first step. Illinois is actually, I think, the first state to mandate this. So that is incredible. I think that this is literally just the very first step, really, to telling our stories. I think that, Asians in America have faced similar trials and tribulations for our entire history, going even back to the Transcontinental Railroad. And I think that it's important for us to learn their stories, learn about their resilience, and learn from what we can do to be proactive and celebrate that history of resilience.
All right, and we thank the both of you for lending your expertise on this issue. Our thanks to Grace Pai and Vivian Zhang. Thank you so much.
Thank you.
Thank you.
And we're back to wrap things up right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
And that's our show for this Monday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news.
And you can also get the show via podcast and the PBS video app. And please join us tomorrow night live at 7. Chicago's Afghan community responds to the swift Taliban takeover of the country.
And a visit inside a nuclear plant that will close by this time next month, barring state action. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman.
And I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe, and good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm named on the 2021 expertise list of the best personal injury attorneys in Chicago.